Hi everybody, Dr. Rhett Polka, 180 System. Today I want to talk to you about a patient who had low back pain and was told to stop golfing. So I had a patient come in the other day. Actually, she came in last week for her evaluation. She's in her mid to late 60s, chronic low back pain, and was told by her doctor and previous physical therapist to stop golfing because golf is bad for your back. So when I did her evaluation, it was pretty obvious that she had a structural scoliosis, and when I got her on the table to start assessing things, it was quite obvious that she had issues that would lead to low back pain. When we got done with the visit, we did the rescreen, and she was able to touch her toes. She could squat down. Single leg stability was much better. She looked really good, with the exception of the scoliosis, which was structural, so I don't expect to change that anyway. I gave her her home exercise program and told her to make sure she uses that a couple times a day for the first couple of weeks because we're trying to change her mechanics and the way she moves, and also told her to make sure she uses that before she golfs. So she looked at me and she said, "So are you saying I'm allowed to golf?" And I said, "I'm saying that I want you to golf because I need you to test what we did today. If you go home and sit around, A, that's not going to help you, and B, it's not going to help me because I'm not going to know how well you reacted to what we did today." So she looked kind of confused, but took her home exercise program and went home. She came back for her second visit and said, "Well, my back was doing great. There's one thing that made it worse." And I said, "Well, what was that?" And she said, "Well, I had to volunteer at Meals on Wheels, and standing for a long time in one position bothered my back." And I said, "Okay." And she said, "But the really weird thing is, I went and I hit a small bucket of balls, and I didn't have any pain. So I went and got another bucket of balls and hit those, and I still didn't have any pain. And actually, I felt better after I golfed." And I said, "Okay, did you do your exercises before and after?" And she said, "Yes, I went through the exercises. I felt great. The rest of the day, I had no back pain." So what she finally came to realize is that golf wasn't her problem. Her problem was she wasn't able to golf correctly because her muscles that are supposed to control stability and produce motion weren't doing either. So she was compensating with her low back, which was already put in a bad position because of her scoliosis. So this is just another example of how conventional physical therapy doesn't do our patients any favors by telling them to stop doing things that hurt if they're not going to fix the cause of the problem. So here with the 180 system, as long as we fix the cause of the problem, which is neuromuscular inhibition, and we educate our patients on what they should be doing and give them the tools so they can do those things correctly, they should be able to golf or play tennis or pick up their grandkids or do whatever they want pain-free. That's all I have for you today. Please continue to watch our videos, take our webinar, and hopefully see you soon for one of our 180 seminars. Until then, learn more about us, follow us, and welcome to the revolution.